And tonight we have our own church member and friend, Dr. Ebony Carter, joining us to share. We're so excited to be able to hear from her and to hear from her expertise. Dr. Carter is an assistant professor at Washington University School of Medicine, where she practices maternal fetal medicine and serves as the chief of the Division of Clinical Research in the Department of Obstetrics and Gynecology. She earned her undergraduate degree in human biology with honors from Stanford University. She has a Master of Public Health and Health Policy from the University of Michigan and a medical degree from Duke University. We are excited to hear what knowledge she's going to bring to us tonight. And so at this time, I'd like to introduce to you Dr. Ebony Carter. And Dr. Carter, please come on forward and begin your presentation.
All right, excellent. What screen are you seeing now? Are you seeing my presenter view or the slides?
We're seeing the slide.
Okay, good. So you don't see any of my own text? Okay, excellent. Make sure it was showing correctly. All right, so good evening to my Union Tabernacle Church family and Pastor and Sister Nix. Thank you for giving me the opportunity to speak with you tonight. And can I just say that Dedrick and the girls and I miss all of you dearly, and we look forward to the day when we can hug and sing and praise the Lord together in person. I'm excited today because the end of this pandemic is in sight, but it's going to be up to each of us to determine how we are going to personally exit this pandemic. And there really are but two options. Number one is to get COVID, and the other is to get the vaccine. And that's it. I'm not here to stand in judgment about your decision, because ultimately each of us has to do what we think is right for ourselves and our family. And I also know that there's a lot of fear and trepidation about this vaccine. And I will be the first to admit that I had some concerns too, especially when it seemed like the scientific process to make the vaccine was being politicized. But I wanted to make sure that I was armed with all of the facts so that I could help my patients make informed decisions. And also I wanted to make the best decision for myself and for my family. So our collective goal in the next few minutes is going to be to separate out the fact, the fiction, and the uncertainty surrounding what we know about the vaccine, so that whatever decision each of us makes is an informed decision. I'll start off with the facts. I'll be very clear about what we do and what we don't know. And then I'll talk about some fiction circulating the vaccine. And we'll do some myth busting together, and then we'll have time at the end for questions. And Sister Jordan sent me questions ahead of time, so I've tried to incorporate the ones that people had ahead into the talk. So let's get started. First of all, I have no financial disclosures. And let's start off by talking about what we know about the coronavirus. So this is actually a cartoon of what the coronavirus looks like. It's magnified thousands of times. And from this picture, you can actually see where it gets its name from, because it actually looks like a crown of thorns. And corona actually means crown in Latin. So COVID-19 is what we call it when it becomes an infection in humans. And COVID-19 just celebrated its first birthday. So it first appeared, this is one of the questions that was asked, where did it come from? It first appeared in Wuhan, China in late 2019. And it seems like it appeared in a meat market when that virus somehow jumped over from a bat over to humans. The problem with this is that humans had never seen this bat virus before. So if you take something like the flu or the cold, we've all seen that every year since we were little kids, and our bodies kind of know how to fight it. So we might have a stuffy nose and a cold and some fever and chills, but our body in general can fight it and get over it. With this coronavirus, human beings had never seen it before. So we had no defenses, and this thing started spreading around the world like wildfire because humans just didn't know how to fight it. And by March, it had become a pandemic. So it was affecting like the entire world. The tricky thing about this virus is that 30 to 40% of people who get the infection have no symptoms. So they can just spread it to everybody else and not even know that it's happening. And then at the other extreme, for every 100 of us who get this virus, one of us are going to die. So we put that in perspective, and like the whole, all of St. Louis gets infected. People are like, oh, it's just 1%. That's 22,000 people in our area who would die if everybody got COVID. So it's nothing to play with in terms of the virus. And then everybody else kind of falls in the in-between where like there's symptoms, but they don't actually die from it. This virus is tricky. It can literally impact any of our organs. So we've had several patients. I'm a high-risk obstetrician, so I apologize. This talk is probably a little bit more bent towards pregnancy than it should be. But even in young, healthy, pregnant patients, I have seen people at death's door and multi-system organ failure from this disease because it can literally do whatever it wants to do. I'm going to point out before I leave this slide. Can you see my pointer? Okay. So these little things that I called the thorns before are actually called the spikes. And these spikes are essentially how the virus gets into your body and invades it. And that's going to become really important for some of the stuff I tell you about the vaccine in a minute. So remember the spikes. All right. I'm going to skip over to talking about what we know about, if you do get infected, this infection is not fair. It impacts people very differently by age and race and medical problems. So we're going to go through those right now quickly. So if you look along the top here, and this is, from like our little babies and the sunbeams all the way up to the mothers of the church and the oldest members, what happens if you actually get the coronavirus based on age? And what you see is among the babies and the risk of either being hospitalized or the risk of dying, actually, it seems like our children are protected, like not completely. There are definitely children who can get very sick, but for the most part, children tend to have a lesser course than the rest of us. And then you go on up through the ages and you see what's happening here. So by the time you're 40 to 49, compared to if you're, in your 20s, you are 3 times more likely to get hospitalized, 10 times more likely to die. And then we get all the way up here to the seniors among us, 13 times more likely to be hospitalized than our 20-year-olds in the church, 630 times more likely to die. So the older you get, the higher your risk of seeing a very severe form of this virus becomes. Now let's break it down by race and ethnicity, because I'm sure that we've all heard about how this virus is impacting people of color. And so compared to white people, in terms of cases, Black folks, Hispanic folks, Native Americans, more likely to get it, almost 4 times more likely to be hospitalized, and almost 3 times more likely to die. And let's be clear, this isn't something about the genetics of being Black. This is systematic racism in this country that has created a series of conditions that mean that we are more impacted. So the types of jobs. So, for myself, right? I'm an emergency worker. I have gone to work every day. Like I have not been home during this pandemic. And so, your occupation and your exposure, all of those things goes into this number. So I don't want people to think there's something about being Black. It's all of the other kind of society forces around us. And then I've had a lot of people talk to me like, oh, I have diabetes, I have hypertension. What does this mean for me? And if you have any underlying medical condition, and I just have a few of the most common ones here from this little cartoon from the CDC. If you have another medical condition, your likelihood of being hospitalized with COVID, your risk of dying for COVID just went up significantly. So this disease is not an equal opportunity types of disease. There are those among us who are much more likely to be impacted. Being older, being Black, having another medical problem. And the other thing, I think the part of this story that is not being told very well is, 1% of us will die. And then what about the people who end up in the hospital or end up sick or whatever else? What tends to happen? And this is just a study that followed people for kind of to see what their symptoms were 6 months after they were hospitalized. So this is the more severe people. So they didn't die, but they were sick enough to end up in the hospital. Respiratory distress usually ends up being the thing that puts people in the hospital. And here you see 6 months after these people got out of the hospital, a lot of them were still sick. So 60% still were tired and having muscle pain. Like almost 30% were still having difficulty with sleeping. So I want to be clear that even if you get it and then you recover, the consequences remain. And this is looking at patients who were not hospitalized. I realize that this is super busy, But the point that I want to make, so this is people who had at least one symptom of COVID. So here, 100% of people in the study had at least one symptom. And then they fast forward 3 weeks and say, okay, how are you feeling now? They never ended up in the hospital. Well, you can see almost 60% of them still have at least one symptom 3 weeks later, and then it kind of goes down. So fatigue, cough, congestion. So this is not a disease that you just have and it goes away. A lot of people, this is going to affect them in the long term and maybe even for the rest of their lives. Okay, so now that we've kind of established a little bit of background about the actual COVID-19, I want to move over to the vaccine and talk about how it actually works. So remember, this is our coronavirus, what it looks like. The spike protein is the bad actor that helps it to get into our body and to invade the cells. Now, these squiggly lines that you see right here, that's the genetic material. And so when this first happened in Wuhan, China, last December, the Chinese scientists did the entire world a favor. So last January, they actually published the genetic code of the virus. So it's almost like, if you had a play, it's like putting out the script of how this thing actually works and what you need to make it. So they put out the genetic code of the virus, and they made a copy of this tiny little section here. And that tiny section is the part that tells you how to make this spike protein, right? The bad actor that helps to invade the cells. And that little piece of genetic material is called mRNA, or messenger RNA. So that's where we get that mRNA vaccine from. So that little piece of genetic material, I like to think of it like a fortune cookie. I think that's the easiest way to think of this vaccine, because I think knowledge is power. And if you understand how it works, then it's not quite so scary. So think about your fortune cookie. You take the fortune out, and the fortune says, make the spike protein. So it can tell your body how to do it. Now, mRNA is super sensitive. It breaks down really easily. It actually took scientists like forever to figure out how to actually get it into the body and have it stick around long enough to actually do anything. So then you have to wrap it in a fortune cookie. So you wrap it in a layer of fat so that it's protected just long enough to get in your body and tell it what it needs to do. Okay, so when you think of the mRNA vaccine, think of your fortune cookie with a message to your body and a protective layer. Okay, and that's my little, they call it like lipid nanoparticles, but that's essentially the cookie part that keeps it safe. So now when we're gonna inject it into the muscle, so when you get the vaccine, it's an injection in your arm. They put that fortune cookie into your body, and essentially it tells your body from that fortune, make the spike protein. And so what you see here is you have that little message. Your body's like, okay, I can do that. And it makes all of these little spikes. And then your body is like, wait a minute, that does not belong here. I need to get rid of it. And so these little Ys here, those are called antibodies. Antibodies are the foot soldiers within your body. They see something that's foreign, that should not be there, and they go and they mount a response and they attack it. And so essentially what that fortune cookie vaccine is doing is saying, make that spike. You don't have to get the whole virus, just the spike. Your body sees it as foreign, knows how to attack it. And that means that if you should get exposed to the coronavirus, it becomes more like the flu or the cold. Your body's like, oh yeah, I've seen that before. I know exactly what to do with that. And it goes and it starts attacking it so that you don't get that severe infection and death and in the hospital, because your body has already gotten a head start and it knows exactly how to attack that virus in the future, okay? So in a nutshell, that's really what the vaccine is doing. It's giving your body the spike protein, teaching your body what to do without ever having to see the entire horrible, nasty coronavirus. So does it work? Is it actually effective? And before I go into that, I want to give a few disclosures. And this is where, I'm going to be honest about what we know and what we don't know. So in those vaccine trials, there were some groups that were included and others that were excluded. So in terms of diversity of ages and race and pre-existing medical conditions, all of that was in there. So if you have diabetes or hypertension, like those folks were in the trial, like this applies to you. But they excluded pregnant and lactating people from the trial. They excluded anyone who was immunocompromised. So if you take a medicine that suppresses your immune system, or if you have HIV, excluded from the trial, and children. So nobody under 16 was in those initial trials. So the stuff that I'm about to tell you applies to this first group up here, but for pregnant, lactation, and immunocompromised children, they were not in the study. And I think we have to be very clear about that as we talk about the implications for the vaccine. So when I refer to those other groups, I'm giving you expert opinion more so than like the data. So this is the graph that I saw that when I personally started being a little bit less skeptical. So Dr. Fauci, back when they were trying to create the vaccine in the summer, said he'd be really happy if the vaccine was 70% effective. Like he would count that as a win. And for a frame of reference, the flu vaccine, which I don't know about you, but I take it every year. And Ma Ruth Ann, I'm like, I know how you feel about this one. I'm always like encouraging people. The flu vaccine is only 40 to 60% effective, right? And we use it every year. Guess what this mRNA vaccine is? 95%. And let me show you what I'm talking about. So this is time zero. This is when people got the first shot. And the people in red got the placebo, like the fake version of the vaccine. So they pretty much got nothing. The people in the blue got the real thing. So they just blinded, randomized, either, you get the real thing, you get the fake one, and you don't know which one you got. And up here is showing you who got the coronavirus, who actually got the infection. So you get shot one, and here they're kind of going the same. So you see more people are getting infected. And then here around the 2-week mark, you see they sharply diverge. The people who got the fake version, they keep getting coronavirus, right? They're still rising and rising. The people who got the real deal, they level off. Nobody else is getting any coronavirus at this point. And I should be clear, what they were looking at is symptomatic infection. So I can't say they didn't actually have the virus, but who cares about the virus? What you care about is, did you get symptoms? Did you get sick? Did it impact your body? And so once you get past like around 2 weeks here, folks who got the vaccine are riding quite well. And people who didn't, their numbers just keep skyrocketing. So this is when I got excited, 95% effective. So Fauci had said 70%, that'll be good enough. And here we are at 95%. They really kind of hit the ball out the park for having a vaccine that works. Some safety considerations I want to talk about. So one thing, in pregnancy, we worry about live vaccines because theoretically we worry about, passing on anything like, measles, mumps, rubella to the fetus. This is not live. It's really kind of the cleanest vaccine you can have because it's literally just a little piece of genetic material and some fat, and it goes in the body and it gets quickly degraded. I told you it's really sensitive, and that's why it needs the cookie around it, like the fortune. It doesn't enter the nucleus. So if you think about this as being a cell, the nucleus is like the brain of a cell. That's where all of your genetic information is housed. The mRNA is not allowed there. It never gets there. It gets degraded long before it gets there. So there's no chance that somehow that virus genetic material is going to somehow get into yours because it doesn't get into the nucleus. And from, like I said, I'm an obstetrician. So theoretically, it would be very unlikely for this mRNA to be able to reach the baby or to reach into breast milk. But let's be honest, there are side effects. So the whole point of this vaccine is to ramp up your immune system so that you create those antibodies, those soldiers, and they go and they run off and they fight things for you. And so this is a list of the side effects of the medication you see here. So fever, fatigue, headache, chills, vomiting, diarrhea, muscle pain, joint pain. I'm having to need medications to address the fever. So there are definitely side effects. And when you get the vaccine, you actually have to wait at the center for 15 minutes to make sure that you're okay. One of the important things to realize is that usually if you're going to have a side effect from a vaccine, it happens quickly, like, in the first minutes to like the first few days of having it. And so this is associated with side effects. And from people I know who have gotten it, the second shot seems to be a little bit worse than the first shot. This is just a plug. When people get the vaccine, they're getting this handout for this Be Safe. And so you can actually, with your phone, just aim your camera at this little thing, and CDC will essentially send you messages and people can send the data back. So if you have a bad reaction or anything, so the government is actually collecting information on vaccine reactions. And so this is going to be a really important source to start giving us feedback even more quickly on what's happening. So I encourage you, if you get the vaccine, sign up for this because this is going to be how we get information even faster. Okay, so what about people who were excluded? I told you about pregnant, lactating, immunocompromised. And I'm gonna breeze through this. And if you want me to talk more about pregnancy, I will. But this is the sum total of information that we know. So even though pregnant people were excluded from the trials, there were 36 who snuck in. They just didn't know they were pregnant at the point that they enrolled in the trial. And in those 36 people, there have been no signals for harm for pregnancy. But I'm not going to make that much of it. Out of 40,000 people, 36, I mean, you can't say that much about 36 people. They also did rat studies in rats that were mating and pregnant. And in those animal studies, they also saw no signal for harm. So that's it. That's all of the data that we have in pregnancy. And it doesn't seem like there's any harm, but that's limited. I'm still, as a high-risk obstetrician, though, saying to my pregnant patients that there's no reason that we think that pregnant people would have any less of an effect of the vaccine than everybody else. So I think that 95%, I can't say for sure because pregnant people weren't in the trial, but there's no reason to think that same level of efficacy would not be experienced by pregnant patients. And this is from the Society for Maternal Fetal Medicine. The theoretical risk of fetal harm from the mRNA vaccines is exceedingly low. I'm going to talk about this quickly, just like I talked about race and age before. So the reason I'm scared for pregnancy is in pregnancy, you tend to suppress your immune system because you have this little foreign being living inside of you and you don't want your body to attack it. So pregnancy is a relatively immunosuppressed state. And because of that, infections can be worse in pregnancy, and COVID seems to be no different. So for pregnant patients who get coronavirus, and we're talking about young, healthy patients here, right? The risk of ending up in the intensive care unit, 3 times higher than if you're not pregnant. The risk of needing a machine to breathe for you, 3 times higher than if you weren't pregnant. This is ECMO is kind of like a heart-lung machine when your heart and lungs can't work for itself, 2.4 times higher if you're pregnant. And the risk of death, twice as high. So, and all of these numbers, if you look at the subgroups by race or by having another medical condition, all of these get even worse. And this is, I work at Barnes Jewish Hospital, and this is our data at Barnes, and we basically are seeing the same thing. Our pregnant patients are significantly sicker than the other patients with COVID in the hospital. So pregnancy is definitely a high risk condition. The other point that I want to drive home in pregnancy, but I think this applies to everyone, this is a study out of California, and they asked people who had COVID in pregnancy and were symptomatic, did you still have symptoms at 1, 2, 3, 4, 8 weeks after your initial infection? And so at week 8, 1 out of 4 pregnant patients still had COVID symptoms. And these are not like mild symptoms to be played with. So 10% of them were still having headaches. 8% of them were still short of breath. 8% of them still could not taste or smell anything. So I want to make sure that we're not minimizing this. People have long-term consequences after they recover from this disease oftentimes. And so I want to make sure that if there's anyone in our church family or who's listening who's pregnant, I don't want to freak you out because most pregnant patients will actually do fine. Like the relative numbers of like the badness are low, but there's no doubt that pregnancy confers much worse disease. And if you have any of this other stuff going for you, then magnify that. I'm going to talk briefly about the baby now because I'm a maternal fetal medicine doctor, so I take care of mom and the fetus. The risk of moms passing the virus down to their fetuses are actually pretty low. It looks like it can happen, but it's not that often. And then for pregnancy complications, if you have COVID, your risk of having your baby too soon increases by a factor of 3. The risk of that baby needing to go to the intensive care unit increases by a factor of 3. And for stillbirth, the verdict is out. I think there's probably no difference, but studies are still coming out kind of either way there. And lastly, for breastfeeding. So when you take the vaccine, there's a reason you get it in your arm. If you drank it, it wouldn't work. And so in the same token, a mom who was breastfeeding, the chances that mRNA, that very delicate thing that needed a fortune cookie to even like get in your body to do what it needed to do, the chances of it making it into your muscle, into your body, into your breast milk, over to the baby, it's really low. So the baby is unlikely. We're actually doing a study here at Barnes looking at that now, but I don't know for sure. It's unlikely that mRNA gets in breast milk. And The other thing I will say is that even if it did, once the baby drinks it, it's going to be degraded. So I think that there's very little theoretical risk for breastfeeding. There is a good possibility that it's actually helpful for baby. So babies cannot get most vaccines and their little immune systems are super immature. So if mom is breastfeeding, she's making those really good antibodies against coronavirus, and then she passes those on to the baby. It's been said that breast milk is a baby's first real vaccination because all of mom's immunity is getting passed to that little one. Theoretically, there's probably benefit to getting the vaccine. Once again, I can't say that for sure, but those studies are ongoing, and I think we're going to have an answer to that probably in the next few weeks. So in summary, vaccination is recommended for lactating people, balancing the risk and benefits, and put everything that I just said in the perspective that they were excluded from the trials, but the benefits likely outweigh any risk. So based on what we know today, and I say that caveat, I'm always like, I want to make sure that when I'm quoted on this stuff 10 years from now, in the fullness of time, we will have much more data and know everything. I want to make sure that I have couched this, and there's many things that we don't know now. But based on what we do know, the known risk of getting actual COVID-19 infection in pregnancy and in general likely exceed the theoretical risk of vaccination to mom and to the baby, especially for those of us pregnant, Black, other medical conditions that are more likely to get severe disease and die. I love this quote from our society president, who is actually a Black woman named Judette Lewis. And she said, "We won't offer a vaccine or certain medications for fear that it may cross the placenta or fear it may harm the baby. Well, I've got news for you. Maternal death crosses the placenta." And I think it's kind of a false equivalency when we say like, oh, I don't want the vaccine, like I don't want to get it. Because the alternative is getting the infection. Like that's the only way that you're going to get, the immunity that body needs to be able to fight this thing. So let's turn to some myth busting very quickly. And these are some things that I've heard. And if there's more questions about myths that are out there, I'm happy to discuss them. So the first one is the vaccine was rushed. And I will tell you, I had some very real concerns myself about this one, because how does it normally take 3, 4, 5 years? And then here we are a year into this thing, not even a year, and we have a vaccine. The reason that the vaccine was available so quickly is because it came on the backs of a lot of other work before it. So I don't know if people remember the SARS outbreak that was in 2002 or MERS in 2012. So these were actually also coronaviruses that jumped from an animal over to a human. And there was a lot of research done because people were scared that these were going to be what coronavirus has been to us now. But for SARS, 744 people died around the world. For MERS, 860 people died. They never actually took off in the way that this current pandemic that we're in has, but people started doing work to create vaccines for them back then. And these are essentially cousins. So they look kind of similar to what our coronavirus looks like. These are coronaviruses too. So it's almost like same family, here's a cousin of it. And so scientists have been doing work on these cousins for the last 2 decades almost. And so we were blessed in some ways that when this coronavirus pandemic came along, all of this pre-work was already done. Now, what wasn't done was huge trials, because since these never really impacted the whole world or killed lots of people, there wasn't really the scientific will to pay for the research, to have huge trials with thousands of people who volunteer to be in them. It just kind of died when these outbreaks died. But with the advent of, last January, realizing that this is real, it's killing people, this is important, it's impacting the whole world, people just picked up exactly where they left off and were able to essentially cut through a lot of red tape, have tons of money, have tons of volunteers. And that's really why this has gone so quickly. It's not that, we just started last January. This work actually started back in 2002 with SARS. So government supported it, red tape was removed, there was plenty of money to get it done. It's pretty remarkable that 2 trials that had almost 40,000 people each have already been done. Like that just does not happen in science, but there was political will and there was necessity because people were dying and suffering. So that's really why this vaccine came so quickly. Okay, the next one is that the vaccine can cause infertility. And I have received tons of questions about this one from my patients. And we can squarely say that this one is fiction. So this claim, and I have a picture of it here, actually first appeared in a blog in England from a guy who worked for Pfizer about 10 years ago. And he made the false claim that there was some ingredient in the Pfizer vaccine that taught a woman's body how to attack a protein that's really important in the development of the placenta. And the placenta is the afterbirth. It's the organ that gets all of the nourishment from mommy over to baby during pregnancy. So if we take a step back to understand, exactly what he's talking about, this is a picture of the spike protein. It's kind of like a little cartoon of it. And then this is the protein he's talking about in the placenta. So remember that picture I showed you, the little Y's attacking the spike protein? He's saying that it could attack the placenta because this protein looks the same. I ask you, does this look the same to you as this? It doesn't to me. And I feel like it's akin to saying that, Daffy Duck looks like Mickey Mouse because they're both cartoons. These two proteins look nothing alike. So it's really kind of preposterous that he even made that claim, but people are terrified, like, oh my gosh, the vaccine is going to attack my baby. Can I also just make the point that if you get COVID infection, your body also makes antibodies, and then theoretically, it should also attack the placenta. And there's not really a higher rate of miscarriage that we're seeing in COVID infection now. So I feel like this is completely debunked. There's a myth that there is a tracking microchip in the vaccine. I will say, I got my vaccine, and I must admit, I definitely looked in the vial. It's all liquid. I think you can look in the vial and see there is no chip in there, but I encourage everyone to take a look for yourselves. There is some thought that getting the virus itself gives you better immunity. And the research in this is still evolving, but ironically, it actually looks like the immunity that you get from the vaccine tends to be better and more enduring than from actually getting the infection, especially if you get a mild infection, your immune system didn't have to get ramped up very much. It actually appears that the vaccine is actually probably better immunity than if you have a mild infection. And I already talked about all of the reasons why getting the actual infection is suboptimal. Like we hope to be the asymptomatic group, but you don't know which group you're going to fall into. There's the myth that aborted fetal cells were used to make it. And fetal cells have been used to make vaccines in the past. That is not true for these vaccines. So neither the Pfizer nor Moderna vaccines used any fetal tissue for development. So that is not true. And so, in the face of uncertainty, and I say pregnant and lactating, but really this is for all of us, let's remember that there are but two choices here. It's either get COVID or get the vaccine. Like, I wish that there was some third option where you didn't have to get either one. But the thing is, this is here to stay. It's going to be around. It's probably going to be like the flu vaccine. And I don't know how long immunity lasts for this vaccine. So there are 40,000 people in Moderna and 40,000 people in Pfizer who are just a few months ahead of us on this journey. Scientists will be watching them to see, when does it start to wane? That blue line I showed you where people with the vaccine weren't getting COVID anymore, is there a little uptick and we need a little booster? We don't know. But I think that those are the options. COVID is here. And so how is your body going to learn how to defeat it? And these are the two options. And so I am putting here, once again, I'm not here to stand in judgment of anyone's decision. Everybody has to make the best decision for themselves. I did, after doing a ton of research and a lot of due diligence and feeling pretty skeptical myself as a Black woman, because, medicine and science is not always done right by us. But after lots of due diligence, I actually did make the decision to get the vaccine for myself. I have already been trying to get my dad the vaccine in Ohio. I can't wait till Dedrick can get it. I will feel so much better about how our family is. And I think it's a personal decision, but I wanted to make sure that as a church family, everyone knew good, solid information so that you can make your own best informed decision. So I'll close by saying, how do I get the vaccine? And the state of Missouri essentially has tiers. So phase 1A was mostly healthcare workers, and then 1B goes to first responders, people over 65, and then people with certain medical conditions, and it goes on down. So the vaccine is still in short supply. And like Pastor was saying at the beginning, the best thing that you can do, and this is what I did for my dad in Ohio, these are the places that are going to be offering the vaccine to the general public. So BJC, Mercy, SSM, St. Luke's. Also, in terms of community health centers, Affinia, I loved them. They actually had a phone number on their website when I looked this up yesterday, Care STL. And then you can also get it through the city or the counties. So if you just Google, if you just put this in Google, or even better, just call Affinia, you can actually put your name on waiting lists so that when your turn comes up, those organizations can call you. So the vaccine rollout, I wish it was, you know, a bit more organized, a bit faster. Missouri has been a little bit slow in this process, but I think, you know, getting your name on the list. So not only do I have my dad on my list, but I'm like stalking it to see when I can get him an appointment, because even though he's up for his age group, I can't get any appointments available. So it's gonna have to take some advocacy on our part. And another question, you know what? I think I'm going to pause here, open it up for questions. And then if people have questions about which vaccine to get, I can answer that too. Right now, it's easy. There are only two, Moderna and Pfizer. They're both mRNA. That's all that's approved in the United States. And I would say, if you can get one, get whatever. It doesn't matter. They are similar enough. The differences are Pfizer, you get the second shot in 21 days. Moderna, you get it in 28 days. They're stored at slightly different temperatures, but in general, they're both great. So just take whatever shot you can get. Most people probably won't have a choice anyway. There's a few other ones in the pike, and if people want to talk about those, I'm happy to. But with that, I will open it up to questions.
Oh, okay, Dr.
Oh, you're on mute.
Okay, I'm sorry about that. We had a few questions in the chat. Now, you may have addressed them, but I'll just go on and say them. The first was, if you had COVID, do you still need to be vaccinated?
Excellent question. I think the short answer to that is yes, because the immunity that you have with COVID, we're not really sure how long it endures. You know, like the best guesses I've seen is probably at least 3 months, unsure, but we are recommending that people who had COVID do go ahead and get vaccinated. And you can have that conversation with your physician in terms of when, because if you just had COVID like 2 weeks ago, probably not. But if you had it more than 3 months ago, I certainly think it's worth it, because you don't know how long that immunity is going to be with you.
So that means you can get COVID twice?
So you can. It seems that it is rare for that to happen. It has definitely been reported to happen. And as the time lag happens and immunity wanes, I would imagine that there's going to be more instances of it happening. So the answer is yes, you can get COVID twice.
Okay, you did answer thank you for that. You did answer the question about infertility. There's a question about Pfizer and Moderna. Is the vaccine a live virus like the flu shot?
So it is not a live virus. And I have a little thing here. So this is a table that's comparing the Pfizer versus Moderna, the number of patients enrolled. You see the effectiveness, 95% for both of them. And then placebo, that means fake. So people, you know, you give half the people the real vaccine, half the people the fake one that has nothing. And so for the Pfizer vaccine, there were 9 patients who got severe and 30 patients who got severe for Moderna. And then in the people who got the real vaccine, out of, you see this 43,000 people, only 1 severe case. And in Moderna, out of, you know, all of these people, only like no severe cases. So I feel like that's pretty compelling. What you actually care about is, do you get really sick? And these vaccines, all of them seem to protect all of us from getting it. So, you know, these are some other difference. So Pfizer, you get 2 doses. The reason you have to get 2 is because you get that initial immune response. The mRNA goes away quickly. And so your body needs a little booster to remind it what to do to get the full effectiveness. So after 1 dose, it's probably about 50% effective. You get that second dose and you get up to that 95% level. They both have the same mRNA mechanism, and then they're stored at slightly different temperatures. But I feel like net, these are very similar. They're both wonderful. Like I got the Pfizer vaccine because that's what BJ was giving, but I would have been happy to get Moderna. It doesn't really matter. Oh, you're on mute.
Dr. Carter, do you know the time frame in which some of the other age groups may be getting the vaccine available? I seem to get that question. When, time-wise, would it be available to them, some of the younger groups?
So unclear, and the vaccine is being rolled out state by state, and Missouri seems to be on the slower end of things. So the answer is I don't know. But I think the general hope is that by the time we get to summer of 2021, that the majority of folks in the United States are vaccinated. So I think for those lowest risk groups, we're probably looking well into summer.
Okay.
I'm sorry. I noticed that on the chart, you didn't have the Johnson & Johnson one, right? And that's the one shot. Do you think that that'll be any more or less?
So the Johnson & Johnson, the benefit is that it is one shot, as you said. It's a slightly different mechanism than mRNA. So the Johnson & Johnson, so there's a few different ways that you can get a vaccine and teach a person's body what to do. So you can either have a protein-based vaccine, you can use a viral vector, or mRNA. So mRNA is the one that I spent all of this time talking about. The viral vector, they essentially take this little red thing, is the adenovirus. That's essentially the common cold. So they take the virus, it's the cold, but it's totally inactivated. It really can't do anything to you. They put that same genetic information about how to make the spike protein, and then your body, so you send this little cold virus with that spike protein genetic information into the body, your body makes that spike protein, and then you get your immunity. So that's how it works. This is much more traditional. Like, this is how vaccines before typically were made. It's a little bit less effective than the Pfizer and Moderna. So the numbers that I've seen are more like, don't quote me exactly, but they're more like 70%. But even so, if you were offered a vaccine and that's the one that you were able to get, I would say get it, because it still prevents that severe infection. So maybe you're more likely to get infected than if you had the mRNA ones, but you're not going to likely die or end up in the hospital. And that's actually what we really care about. The other thing I will say is, once people get vaccinated, I would still not let guard down. So we're still living in an area that has high rates of COVID everywhere. And so we're not going to all be protected until there is herd immunity and enough people that the numbers of people with virus in the community are suppressed. So even though I am fully vaccinated, I got my second shot on January 8th, I'm still masking, I'm still socially distancing, I'm not going places, because until the level of infection in the community is lower, we're all going to still have a shared risk. So people still need to be vigilant until we get probably like into late 2021.
So Dr. Carter.
Yes.
Can you hear me?
Yes, ma'am.
What if you have gotten the vaccine and someone else, and you around someone else and they have the COVID, can you also get the COVID again once you had the vaccine?
So I think the answer to that most likely is yes. But when they did these trials, what they were concerned about was not, are they infected or not? The question really was, are they infected with symptoms? Mm-hmm. So you're asking a really good question that we don't completely know the answer to. I haven't read that. Full disclosure, I haven't read the actual article, but there was a New York Times article that was saying for the AstraZeneca vaccine that it actually seems to do exactly what you just said and minimize the risk of getting infection. But what we know about these vaccines is they minimize the risk of getting symptomatic infection. We don't know how it spreads among people otherwise, because that's not what they were looking for. They were looking for symptoms. So the true answer to your question is, I don't know for sure. But I think your risk of getting infected if you're exposed to a patient with coronavirus with the vaccine is significantly lower than if you didn't have it. And your risk of getting a symptomatic infection, which is what we care about, is definitely much lower. Does that make sense?
Yes.
Dr. Carter, this is Minister McKinney. I got a couple of questions.
Yes, sir.
On the side effects you get after the vaccination, is that common with everyone or does it depend on your physical makeup? Does everyone get those symptoms or do it depends on your physical makeup?
So I think that I'm going back to the slide that I had with the side effects, because I believe it had percentages on it. I think that universally people tend to have a sore arm. So I know that my arm was sore for the day after I got it, and I think that that is true of most people. So yeah, so these are the percentages of people. So, in terms of fatigue, 60%, muscle pain, 40%. So yeah, like I think it varies. I think most people will have some symptom, usually like the muscle ache and that kind of thing. But in terms of like just anecdotally, in terms of my colleagues, I would say that 3 or 4 of us felt pretty sick the day after the second vaccine, like didn't want to go to work, felt super fatigued, like fevers, chills, like did not feel good. For most people, that lasted about 24 hours and it was gone. And of my colleagues, I mean, that was probably 10% of us. So I think that when you get the vaccine, just prepare yourself for like the 24 hours afterwards, just to have a nice light day where it's not stressful, there's not a lot to do. Because I think most people will have a symptom, and it's a much smaller number that are going to be like sick and not wanting to go out.
Okay. Now, concerning the sign up, now I went online and I registered for the St. Louis County, which I live in the county, and I registered for the to get on the sign up list. Now, do I still need to call this a number for affinity?
So it depends on how aggressive you want to be. So if I was serious about getting it, like what I did for my father, I've registered him in multiple places. Like every place I could register him, I registered him, because I feel like wherever he gets it first, that will be great. So it just depends on how aggressive you want to be. Because I don't know, given the demand greatly exceeds the supply, I think the people who get vaccinated earliest are going to be the people who are aggressive about it. That's kind of what scares me. For Black people, we know that we are more likely to get symptomatic infection, to get hospitalized and die. And it's going to be the people who advocate the most who get it. And even within the healthcare system, if you look at like who's getting vaccinated, the physicians, almost everybody is vaccinated. The nurses, a lot, but not everybody. And as you kind of go through the ranks, the number of people vaccinated falls off. And I think people are skeptical and all kinds of other things. So I think that everyone is going to have to advocate pretty heavily to be on the earlier end of this.
Okay, one other question. Could you kind of explain that term symptomatic? That I don't really understand that term symptomatic.
Sure. So one of the things that really tripped people up early on, do you remember like back in February, March, they were screening people for symptoms? I mean, actually, they still screen me for symptoms when I come in. But depending on where you are, like I think in Korea, they found that like 30% of patients who had the infection were totally fine. Like they didn't know anything was wrong with them. Versus there's other people that get it and they know that something's wrong. Like they can't taste or smell anything, or they have a fever or a cough, or they have some other symptoms. So it's really just, are you walking around and like you never knew anything was wrong with you, or do you feel like something is kind of off? And I think a good example of that is, if I go back to this slide kind of goes through a lot of the common coronavirus symptoms. So fatigue, cough, headache, aches, fever, chills, loss of taste, loss of smell, diarrhea, congestion, shortness of breath, nausea, sore throat, chest pain, abdominal pain, confusion, vomiting. So those are like the common symptoms that people have with the virus.
Okay, thank you.
Hey, Dr. Carter, there is a question in the chat that said, since no trial was done on children, can kids get vaccinated or is there an age limit?
So there is an age limit. So the Pfizer and Moderna vaccines, you have to be 16 or 18 and over. So that's essentially what the limit is. They are now doing trials actively in children. So children are going to be towards the end of the line anyway, because they tend to get less severe infection. But by the time it's their turn in line, hopefully these trials that were done in children will be available. So right now, the youngest that you can be and get the vaccine is 16.
Okay, thank you. Other questions?
Do you know if we have to get this shot every year or just a one-time deal? Like the flu shot, you get it once a year, or is this something, it's just a one-time shot?
Excellent question. And the answer is, I don't know. So like I said, there are the people in Moderna, Pfizer, and as these additional vaccines that are in the pipeline roll out, there are people ahead of us who were in the trial. And so what happens to them is going to dictate. My best guess of what's going to happen is that coronavirus is going to be in a few years like the flu. And every 12 months or 18 months or whatever that period is, that there's some variant that comes out and they adjust it and there's a booster that's available. And this becomes something that we just live with forever. And the symptoms, because we've seen it before, become like the cold or flu symptoms and people just kind of get it every year. Like that's my best guess of what happens. But I think that this is showing everyone how science works in real time. This hasn't been around long enough to know, just like in pregnancy, the women who got infected with the coronavirus in the first trimester in Wuhan, China last December, their babies are only a few months old. So we are seeing this in real time. And there's just a lot that we don't know, but we can make educated guesses because it's not like we haven't had pandemics or viruses or infections or vaccines before.
Thank you. Are there any other questions on the Zoom tonight that you might want to have Dr. Carter address?
I got one more, man.
Okay.
So you said typically during a trial, it's like 36,000 or something like that. I may have the verbiage a little off before they roll it out. And I know with this particular trial, it was 36,000. What's the typical number that they normally go with, or how many test studies they have before they roll it out?
Yeah, so this is pretty typical. And the concern, because I just remember thinking, if you're going to vaccinate the entire world, you better get it right. Like you better not cut corners. You better do all of the things and all of the checks and balances. And I had a slide and I took it out, but it essentially shows the Food and Drug Administration approval process in the United States is probably the most stringent process in the world. But there tends to be like starts and stops to it over time. And these trials are expensive and there's all of these other things. So the size of the trials is comparable to what's been done in the past. The main difference was that there was so much money. So the government for Pfizer and Moderna last April fronted them the money to do all of the work on the trial so that they weren't going to be out, financially, destitute if things didn't work out. That doesn't usually happen. Usually there's gamble and there's risk and there's stops and there's starts. So there was really no steps that were cut out. The thing that was cut out was like the lack of funding and the starts and stops that tend to happen. So this really was a full-fledged process, all of the checks and balances. Now, there's usually longer term follow-up. And when the Pfizer Moderna vaccine got rolled out, the follow-up was 2 months. So that's a little bit on the short side. But remember what I said about vaccines. Usually, if there's going to be bad side effects from vaccines, they're in the short term. Like they're in days to weeks. They're typically not years. And we also have to keep in mind, what are we comparing it to? The coronavirus. I only have a year of follow-up and a year of data for coronavirus so far, but based on what I told you about these long-term consequences, it doesn't look good. So when you compare it to the alternative, the theoretical long-term risk of the vaccine are so much lower than the theoretical long-term risk of COVID. And that's really what the choices are.
I just want to say I was thankful to be here to listen to all what Dr. Carter said, and now I'm getting ready to get on the list.
All right then. Okay, great. That is Gracious Father, we again say thank you for the opportunity you've given us to be on the line tonight. We thank you for Dr. Carter. We thank you for Minister Jordan, First Lady Nixon, everybody that was involved in organizing this review session. God, we again claim that with the vaccine, all is well, and that we're going to stand and trust you, God, for all that you are and all that you can do. So, God, we still stand on your word, and we said knowledge gives us power. So God, we thank you for the knowledge that we've received tonight, and that knowledge will translate into power, and that is the power to control this pandemic from going forward in each and one of us. Once again, God, we say thank you. Bless in the mighty name of Jesus, we ask it all. Amen and thank God.